If you're having painful insertive sex, you might have been told about vaginal dilators or accommodators. These are a series of tools that are used to work towards more comfortable penetrative activity. If you have received gynecological cancer treatments such as radiation therapy, you may have received a dilator from your cancer center or provider. It may look something like this, or it may be white. These are firm and used to insert and press against the vaginal opening and internal structures within the vagina in order to help keep elasticity and movement during radiotherapy, which can cause scarring and stenosis or changes that make the structures less flexible. You may want to use this, but there are also other options on the market. This is an example of a set of graduated dilators that move up from smaller to larger. So at its most smallest size, these dilators or accommodators look like this. So small and the next size up, and then move progressively into larger sizes. Now, some come in sets of 8, some come in sets of 4, and so you kind of figure out what are the sizes that you need. But basically, you're using this, or smaller as needed, to insert into the vagina and to move against the edges of the vaginal structure. And what this is allowing is some accommodation and stretching of those tissues, but also allowing you to be in control as you're inserting, rather than a partner who's inserting, which may feel like you have a lot less control. When you're using smaller objects as well, you're working up towards the capacity for a larger object. This also helps with desensitizing your nervous system and your fear response that you might have if you've traditionally experienced pain before. When we know that we've had pain before, we often expect pain. And then we have a body tension response. We tense up and we worry, oh, it's going to be painful. And then that also creates more difficulty to have pain-free or more comfortable insertive activity. With this, when you're using this on your own, you can be confident that I was okay and I could handle that, which allows you to feel more prepared and ready for when you move up into a size that's perhaps more similar to a partner's size or to whatever kind of object you might be wanting to use during your sexual activities. We don't recommend that dilation or accommodation is done without the support of a healthcare professional. Typically, a physiotherapist or a sex therapist can help guide you through that process. It's not something that we recommend that folks just kind of go for and push through themselves. We really do want that to be very slow and supported. If you are not confident and comfortable as you're engaging, you're probably not going to receive the benefit from the treatment.